So it's quite important that we pay attention to our health also. And this time around, she's going to talk about it in the physiotherapy way. So, friends, family, call out musicians. Without much ado, let's welcome Mary Alikor, the therapist.
Hello. Good afternoon, everyone. Before we proceed, please let's all be on our feet. And just like when we were in nursery, our nursery rhymes that we were reciting, a lion has a tail. When we are getting to the end, he said it has a big head and a very small waist. So let's all do it. And a very small waist. 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 Thank you very much. You can take. We've been sitting for hours, so we need to at least stretch. I'm sorry I couldn't project my slides. I'll be doing a lot of the talking. And I want it to be interactive. So whilst I'm talking, you can also be asking questions. I don't want to be doing the talking alone. So whilst I'm talking, you ask questions and then we start answering it. Thank you. So today we are talking about back care and its safety protocol. And please, who has ever experienced a back pain? And how is it like? Please, I want someone to answer. How is it like? How is it like? And someone said it's uncomfortable. And how did you manage it? Sorry? You sleep on your pillow. That's how you manage yours. Okay. So how is it like? Is it going or the pain is still there? It's still there. Thank you. That's one secret about back pain. If you don't manage it well, if you don't really take care of your back, if you don't take care of your spine, and you develop a back pain that progress maybe arthritis, you can't manage it. It can't be cured. It can only be managed. But the damage has already been caused. So today we are talking about back care and its safety protocols. How to take care of our spine so that we don't develop back pain. So we talk about the back, the structures of the back, the human spine, back pain and back care and protocol. So we say the back. It can be viewed as a region from the occiput. That means from this place. From the occiput, from this place. To the gluteal fossa, in between my thigh. So from this place in between my buttocks, it's my back. If I say the back, that's what I'm talking about. It's composed of bones and a powerful muscles. The spine or the backbone is made up of 33 bones called vertebra. We have 7 cervical, thoracic 12, lumbar 5, and 23 intervertebral discs. And then we have the sacral vertebra, which is the tailbone. Here, in between my buttocks. That's the sacral bone. And then the causes as well there. I don't have, it's not projected like I would have shown you. And we say basically, the back serves to support the body and also it allows movements. So then we move to causes of back pain. The commonest area of back pain is the low back. Why? Because it bears most of the body's weight and most movement of the spine occur there. Continue with the causes of back pain. We have muscle tension, arthritis, bone spasms, degenerative diseases, and then herniated discs. And then 80% of population will experience some form of back pain at some point during their life. And then back problems account for 40% of injuries among musicians. This is the CalledOut Musicians Seminar. We come to signs and symptoms of back pain. Swelling, redness, and then difficulty moving that particular joint where you have the pain. It could be your waist, your upper back, or your neck. You have difficulty moving that place. And then you feel numbness. The place becomes very numb. So we say early recognitions of signs and symptoms. The signs that I've mentioned here, the signs of symptoms, early recognition of them and appropriate responses are critical in minimizing the severity of its health effects. Then we come to the levels of pain. Level 1, pain occurs after class. Since you are musicians, pain occurs after class, after practice, after performance, but the individual is able to perform normally. Then we come to level 2. Pain occurs after class, after practice or performance, but the individual is restricted in performing. Then we come to level 3. Pain occurs after class, practice or performance, and begin to affect some aspect of daily life. The individual must alter technique or reduce duration of activity. That's where we see some people, you see, instead of them standing straight like this, they'll be like this. But they have to alter technique to be able to stand. So at the end, that's how they'll be walking. Some people, they are like this. So when they are walking forward and we're behind them, it's like they are walking backwards. And level 4, pain continues. Pain occurs as soon as the individual attempts to participate in class, practice or perform, and is so severe to continue. So as soon as you begin to perform activity, then the pain will restrict you. So such people, you see, they are not able to perform in daily activity. They are always limited. Like if it's a drummer who is supposed to play, the moment he sits to play, he's uncomfortable. He has to stop. If it's a keyboardist, you sit to play and then you start experiencing back pain, neck pain, upper back pain, so you have to stop. And then the 5, pain is continuous during all activities of daily life, and the individual is unable to participate in class, practice, or perform. So in this instance, maybe you can even be bedridden. You can be in a wheelchair because even getting up to work becomes a problem for you. And then I move on to say that if you are on level 1 and level 2, when the pain occurs when you are practicing, when the pain occurs when you are doing activity, those are modifiable risk factors. So those ones you can take care of them. If you sit to play and you realize that after playing you feel pain, maybe at your back, maybe at your neck, then you know it's your posture. So you have to assume a proper posture. If you are on level 3 or higher, then you have to seek medical performance. Level 3 or higher is when you want to do the activity, you are restricted because the pain is too much for you. Or sometimes you can't even get up to do that activity. Then it means that you need to seek medical assistance. Please, is there any question up to this, please? Or should I continue? So I come to the back curvatures. We've seen a lot of people walking like this, like their head is almost down. A lot of people, some people, that's the posture they've assumed from childhood and they've grown with it. And some people it's because of activity. Let's say the keyboard is always playing and always the head is always like this, always like so. It will get to a time, if he doesn't take care of it, that's how his posture will be. So assume that posture, even if he's not playing, you see the head will always bend like this. And then the side curvature, just like I said, some people are always like this. Let's say I've been sitting for so long and I'm uncomfortable. My waist is paining me. So I try to adjust myself a little. So maybe I'll turn to this side. I'll be there for some time. No, it's not comfortable. So I have to go to the other side. So I'll be doing that before I realize, I will shift to one side. And I'll be walking, and when I'm moving forward and you are behind me, it's like I'm coming backwards, but I'm moving forward. That condition is called scoliosis. So just like I said, early recognitions of the signs and symptoms. If I'm a drummer, I'm a keyboardist, and I'm playing any of the instruments, and maybe I'm tired, I cannot get up to stretch. Just like when we begin, we all stood up to stretch. I may not be able to stretch. So after playing, and then maybe a pastor is preaching, that's the time that you can stretch. Or after the activity and you go home, you don't need to go and sleep on the pillow. Find a flat surface, you lie down and stretch yourself. Are you with me? We find a flat surface, you lie down and stretch yourself. You can be there for 30, 20 minutes. If not, and you are fortunate, maybe within each activity you have like 5 or 10 minutes break, you can get up and stretch. You stretch your neck, you stretch your waist. Any part of the body that you feel you can stretch, we stretch it. But if we are not able to modify all this one and it progress, then that one we need to see a medical assistance. That's when we have arthritis, herniated discs, and other stuff. That one we need to seek professional assistance. Let's say we've assumed one position for so long. So it gets to a time our muscles become very tensed. That's why we have the sprains, the strains. The plates become very tense. So ligaments began to stretch, tendons began to stretch, it will become loose or even torn. So when it happens that now it progresses to the spine, to the bone, that's when we have the arthritis, bony spine growth, herniated discs, and other stuff. When we get there, that one is not modifiable unless you seek professional assistance. And even that, the damage has already been caused. The damage to the bone has already been caused. It cannot be cured. So what we do, maybe it will just be some management. We take some painkiller medications, maybe physiotherapy, some massages and exercise just to manage you for the pain and maybe to improve your activities of daily living. But the damage has already been caused. It cannot be corrected again. But when we have the muscle tension, the place is tense. After activity, you feel like, oh, my neck, after each activity, my neck, I cannot stretch my leg. My waist, then that means you need to modify your activities. The activity that caused that pain, you need to start modifying. If it's your chair that you were sitting on, that wasn't comfortable for you, you have to change it. And if not the chair, to maybe after each activity, just like I talk about the stretching and other stuff, or maybe book a physiotherapy session for some gentle massages, it will help our spine. Please, is there any question after this? I don't have a slide, so I don't want to be doing all the talking. Yes, that's right. Depending on what, if it's just muscle tension, massage is okay. Please, any other question? We don't have the slide. We should have projected with some videos, with some pictures, so that we would understand it better. So I don't want to be doing all the talking. Any other thing? Please, is there any other thing? So none of us here is experiencing waist pain or neck pain. us here is experiencing waist pain or neck pain or any other back pain. I so ask questions. Or you are okay with your pain, you can live with it. I talk about the modifiable risk factors. You need to sit down and assess yourself and see what is actually causing the pain, and then you modify it. When it progresses, then you need to seek medical assistance. Maybe after activity you feel the pain, then you know that this is what is causing my pain, so I need to modify it. But when it progresses, then you need to see medical assistance. Just like I said, the back is from the occiput, from this place up to in between my buttocks. So it can be from that place too. Just like I talk about the modifiable risk factors. When you are able to know, assess yourself and know that this is what is causing my pain, then you know what to do. Maybe stretching will be good for you. Maybe standing down for a while will be good for you. Maybe lying on your back. But if all those things is not helping, that means yours is not modifiable. So you need to seek professional assistance. Back sleeping postures. It depends on how you sleep. If the pain is already there, then sometimes all positions wouldn't be comfortable for you. But if there is no pain, are you with me? But if there is no pain, you don't have a back pain, but you sleep and you wake up and you know that, no, I'm not okay, I'm having a pain, then it means your position for sleeping is not okay, it's not comfortable. There are some sleeping positions that I would have shown, but because I couldn't progress, so I'll take that off. No question again. Should I continue? Should I continue? Okay. So sometimes our pains will be radiating to our lower limbs. Let's say for lower back pain instead. Some people may not even really feel the pain at the waist, but they will say, oh, I can feel some numbness in my feet, some tingling sensation. And it means that yours is not modifiable. Maybe there could be a nerve involved or something else. So in these instances, we need to seek professional assistance. Or maybe someone will say, oh, my whole arm, my shoulder, my fingers, I'm feeling some tingling sensation and other stuff. It could be a problem from your neck that is radiating through the whole arm. So in that instances, it's not modifiable. So you need to seek a professional help. Is there any other question here too? No. Back pain is only caused when there is an injury, direct injury to the back, but medications no.
And you are doing exercise, will it help heal it?
Yes.
Especially, and how about if the back pain you are doing exercise is not healing? And what should you do? I'm saying that how about if you are doing the exercise and yet still the back pain is not healing? What do you do?
And it means yours is not modifiable.
Qualifiable.
Your back pain is not modifiable. When I was talking about risk factors, I said some of them can be modifiable. So if you are doing the exercises, doing all your therapy, taking medications, and still the pain is not going, just like I said, back pain cannot be treated. It's just manageable, just like diabetes, just like BP and other stuff. Back pain cannot be treated. It's just modifiable. So we try to, it cannot be treated. It's just manageable. So we try to manage the pain that you are feeling. We try to manage it for you so that with or without the pain, you can still live. You can still go about your daily activities. That the pain will not restrict you. Are you getting me?
Hello. If you are feeling a pain in the back, is it caused by a dislocation or something?
It could be, but not always. It could be.
Thank you.
Some of the vertebrae could be dislocated, but it's not in all circumstances. And when it gets to that stage, it means it's very severe. That one, if you are not serious, if you are not, it can even put you in a wheelchair. If you are not conscious of yourself, it can put you in. Any other question, please? But the truth is, just like I said, 80% of us will all experience back pain. 80% of us, we will all experience back pain. But sometimes it's the onset. Some occurs earlier than expected. Just like the aged. When someone above, maybe from 50 years, 60 years, complains of waist pain, kind of normal. Because we will all experience. Because once we are growing, our bones loses their mineral density. So begin to experience pains in the joint and other stuff. But from our youthful age, when we start experiencing those pains, no, that one is not normal. So we need to seek professional assistance. And then check our lifestyle as well. Is any other? Any other question? Okay. If there is no question, then move on to the protocol, the back care protocol. Please, can I get someone to use as a those are great. So this is Sister Grace sitting. Go ahead. I hope we can all see here. So this is the correct sitting posture when we want to sit. So this is our correct sitting posture. You see his feet is touching the ground. So if you are short and you sit and your feet is not touching the ground, you find some support there and put your feet on. You see his back is straight. His back is straight. He's not slouching, just like most of us are sitting. See how he's sitting, his back is straight. So when his get up, it's okay. But when you try to slouch, this is sometimes we like sitting like this. You get up and you be feeling pain at the lower back. And look at his neck. Sometimes our TVs, our computers. So that's how we raise our neck, our head, to watch TVs or maybe be looking on computer screens and other stuff. By the time you are done for 2-3 hours, then neck pain, and bring it in. And then our phones mostly. This is how we bend our neck. And we'll be looking on our phones for 2 hours, 3 hours. By the time you are done, and then neck pain as well. So let's all take care of our spine. And then we should be conscious of our posture when sitting. So that's the correct sitting posture if we want to sit. But if due to activity, maybe the work you are doing, maybe I'm a drummer, I'm a keyboardist, I couldn't assume this posture. After playing the keyboard, you get up and you stretch. If it was my neck, that was like this. After playing the keyboard, I get up and I try stretching my neck as many as possible. If I've been sitting for too long, maybe more than hours, when I get up, I start stretching. When I go home, I lie flat on my back for some time, at least to relieve me of the tension on the muscles. Are you here with me? So these are the modifiable risk factors. If it's due to activity, of course we can modify it. But when it progresses, if due to activity, we couldn't modify it, it has progressed, the tension has been built. Now ligament has become loose. Some are even torn. Then it progressed to the vertebra, the backbone. At that stage, it cannot be modified. Okay, thank you. If I said the back should always be straight. You're welcome. Please, is there any question on this? Okay, so most of us, we've been slouching in our desks, in our chair, and it's like we've become used to it. So when we try assuming the right posture, we start feeling pain. Who has ever experienced that before? We've been used to that posture. So it's like our muscles has become tense. We've already built that tension. So when you try sitting up straight, that is when you are trying to release that tension. So that's that pain that we felt when we try to sit upright or we try to correct our postures. Any questions? Should I continue? Question or I should proceed? I should proceed then. So we come to the correct lifting, or not necessarily lifting. If I want to pick something from the ground, I think that one most of us knows about it. If I want to take something from the ground, no. Every activity we perform. Oh, I think someone was doing it. Yes, thank you. Please demonstrate it and let's see. Thank you. Oh, no, Peter, no, don't get up. I just want to. You see how he is? The spine is straight. The knees are bent. So this is the right posture when you want to pick something from. Oh, the same as if I want to lift, it should be the right posture. Please get up. But if I slouch like this, please, are you all here with me? If I try bending like this, it means I've slouched. My body has deviated. It's no more 90-90. My spine is no more straight. So if I keep doing this position for some time, maybe 3 years, 4 years, 5 years, especially with heavy lifting, sometimes we'll be try lifting something heavy. A lot of people have been coming with that hospital with that complaint. Oh, I just tried picking something from the floor, or I just tried lifting a bucket of water and I had care. And that is my problem up to now. Because you didn't use the right protocol for lifting. Your spine wasn't straight. So when you hear that care, the bone could be dislocated just like someone had. There could be a muscle tension, and maybe it has stretched or it is torn. A lot of issues can occur there. If you are not careful, and it's a bone dislocation, it can affect a nerve, and that will be the end of you. You can't walk again. And just like I said from the beginning, for the modifiable risk factors, yes, you can modify it, you will be fine. You will not even know that this person experienced back pain. But the non-modifiable ones, it's not treatable. You can't treat it. No matter what, you can't treat it. You just have to manage it so that you can live with the pain. It can put you in a wheelchair, you still be in the wheelchair. You can't get up again. You just be coming for the therapy so that maybe we prevent further damage, but in the wheelchair you are still there. Maybe your muscles, we just try strengthening some muscles, try standing you up, but still, you are still in the wheelchair. Are you with me? Oh, please, any question after this? Yes.
So in case this lifting thing, I want to lift my wife, how do I bend to? Because, am I asking the right question? Yeah.
on the position what your wife assumed before you try lifting. Yes, thank you. The weight is also very important. And sometimes it depends on the position your wife. But every activity, we should make sure that our spine is always straight. We go on our knees rather instead of slouching. And we shouldn't lift objects that are heavier than us. Let's say I weigh, what is the weight of a bag of cement? Is it 45 or 50? 50 or 60? 50. Let's say my weight is 50 kg. I can still lift, if I can, then I can lift a bag of cement or less. But I cannot lift a weight which is more than 50. I'm putting more pressure on my spine. That thing shouldn't be heavier than me. If the 50 I can lift, fair enough. But if I cannot, I shouldn't force myself. But if it's more than my body weight, no, I shouldn't attempt it. I'll be putting more pressure on my spine.
So if your wife is heavier than you, don't lift her. But she said if the weight is more than your weight,
it's not
don't
advisable.
wait.
It's not advisable to lift something that is heavier than
It's
you.
not advisable
It's not
to lift.
advisable.
So if your wife is heavier than you, don't lift her.
Yes, don't lift her.
That's for some time. And then upon getting up, you realize you cannot just get up.
Yes, thank you. That was part of my slide. I nearly forgot. Thanks for reminding me. Yeah. When we are sweeping, that short broom that we've been using to sweep, it's not good though. That's why we have long brooms. So instead of using that short broom that will cause problem to your spine, we should switch the long broom so that you don't bend your spine. Thanks for reminding me. It was part of my slide, but because I didn't forget, so that's also one of the protocols of back care. And please, any other question? Okay.
Please, how about visiting the massage therapist when we have problems with our back? And also, weight lifting. We go to the gyms to lift those weights. Is it advisable?
Thank you. Massage is very good for us. Me, for instance, I would advise that maybe after a busy day, at least book for a massage session. If it's just once in a week, it's okay. And now, let's come to the gym. You see, we have instructors at the gym. So sometimes when you go, the instructors. And those that don't have instructors, just like I said, we shouldn't lift anything that is heavier than us. So if that weight you are lifting is heavier than you, please don't lift it. Are we okay?
So let's say after the day's work, you feel this pain on your back and your neck, and then you want to stretch. Do you have the right way of stretching? Because sometimes someone will just put their broom here and do this. Is it the right way of stretching your back, or we have other ways?
Just like I said, you assess yourself and know what is actually causing the pain. If it's sitting for too long, then you know that probably it's from your waist. Then you know how to stretch your weight. If it's your upper back, maybe you lie flat at your back. I'm just saying that doesn't mean that it applies to everyone. These are the basics. Just lie on your back. If it's your neck, then you know how to modify it. If the neck has been like this for maybe like 7-8 hours in a day, then when you come home, it means you have to start stretching your neck.
Your nervous system, that's what I was asking. Because people do it in a way that it will sound, and you even feel scared for the person. Meanwhile, there might be a right way of you stretching your neck so that doesn't cause further harm.
You seek a professional help. Even me, those things that they've been doing, I'm even afraid. What if you do it and you can't turn your neck again? Yes, that stretching there is not appropriate. That kind of stretching is not appropriate. That you stretch out, you do stretch out, it's not appropriate. If it's a professional doing it for you, then he knows what he wants to achieve. That's why he's doing that kind of thing. Maybe yours might not be severe as what I'm feeling. So maybe what you are doing, the professional may do it for me, but not for you. Are you waiting? Maybe yours might be just a muscle tension and you are trying to release it. And then you stretch more than your range. And before you realize you've damaged your spine. But maybe mine might be a discompression. So maybe my professional may try to relieve the stress. Then that thing is applicable to me, but not you. Any other question? We are ending. That's the last part. So any other question? Okay. So before we end, we should engage in strengthening and stretching to maintain a healthy, flexible back. And also we should also engage in some form of physical activity. At least every one of us, if not exercise, please, do you know the difference between exercise and physical activity? Have you ever heard of it? Exercise and physical activity. Exercise, physical activity. No one. Exercise and physical activity. So let me use the layman thing. Let's say anytime I'm going to work, I drive. I'm in my car, and an air-conditioned car. I drive to work, drive home. During the day, I'm always at work. I'm always in my office with an air condition. So I don't really get to work in the sun. You understand? And I'm always driving. I don't really work like someone who might be selling or something. So in your case, just engage in a little bit physical activity. So if I decide that maybe if I work at, let's say, so many polyclinic, when I get to so many roundabout, I'll park my car there, then walk to the polyclinic. That's the physical activity. That's not an exercise, but it's just a physical activity that you want to engage in. So I'll park my car there, walk to the polyclinic. When I'm coming, I'll walk back. That's a physical activity. And the exercise is what I have planned, like what the footballers do, like what the athletes do. That's one is an exercise. Like what we go to the gym to do. That's one is an exercise. But this one is just an unplay, just a physical activity. I just want to be active. So I put something in my daily curriculum just to make me active. But it's not really an exercise. So we engage in strengthening, stretching, and then if nothing at all, if we cannot engage in exercise, maybe a physical activity, maintain a healthy back. Thank you.
All right, so let's do it better for her. Oh, slap your hands. Slap your hands for her. And that's Madam Mary Alikor. God bless you. Amen.